the corporate health segment of the Business Africa Live show, just as we do it every Friday. Today we are going to talk about one very important practice, and it's a healing process, and I believe that it's important that we pay attention to this segment today, because it's something that you don't really want to have to miss this. But before we go to the subject for discussion, let us remind you that the Business Africa Live show is being sponsored by the GN Bank, and you also have to remember that GN Bank is one great bank that really offers great services to its clients, and one of the key products is the savings account that offers 9% interest rates. There is no other bank that does that in Ghana. I mean, GM Bank really wants to make sure that its clients get real value for its investment or its savings. So they're giving you 9%. Not only that, they're also giving you 1,000 Ghana cedis life insurance cover. So all that you need to do is just walk into any GN Bank and open a GN Bank account. Just open a GN Bank account, and then automatically you qualify for 1,000 Ghana cedis life insurance cover. Not only that, you also get 9% interest on your savings. No other bank gives you that. Some other banks are giving you 3%, maximum 4%, but GN Bank gives you 9%. So that really is what you need in this time of economic economic hardship. That's what you need. And then also remember that this program is brought to you live from Coconut Grove Regency Hotel, which is also a sponsor of the Business Africa Live, Gold Coast Brokerage and Gold Coast Fund Management. You can watch the Business Africa Live and other programs on BTA via satellite when you have a satellite receiver, or you can go get yourself a First Digital box, and then you can watch a bouquet of very exciting programs on the First Digital box. But if you're in the office or you're roaming around and you still want to watch, you can just go onto your tablet or on your internet and type www.businesstvafrica.com, and then go click on the watch button, and then you can watch the Business Africa Live show. So today we have the privilege, indeed, it's an opportunity for us to get healthy if we pay attention very well. And today's education is on the chiropractic health care in Ghana. And I have with me Dr. Bryan Cox. Dr. Bryan Cox is the CEO of the Spinal Clinic, and then he's the first and only person of African descent who was nominated, or to be nominated, as the fellow of the International Chiropractic Association in Ghana. I don't know where it is, but I think it's international, so it's going to be recognized worldwide. So Dr. Bryan Cox, you're welcome.
Thank you.
Well, it's good to have you in our studio, because we have talked a lot about what you do, the spinal clinic. You know, I hear a lot more people talking about spinal problems and things like that. But my first question basically is that what really if you can take us briefly on the chiropractic, what really is it about?
What is chiropractic?
Yeah, the chiropractic. Yeah.
Okay. Well, if you break the word down, chiro is basically a Greek word meaning hands. So basically, it's done by hands. So when we adjust, what we do is we use our hands to get people healthier.
Okay.
Now, what we do is specifically work with the spine. Now, let me use this because I think we must educate people, because some people have never heard me speak before. I know you've heard me in the past, but I believe we must get some type of education about what the spine is. Now, when you look at your spine from the front or from the back, there should be a straight line from head to the buttocks. If there's any movement to the left or to the right, anywhere on your spine, that's not good. Now, in the neck region is a bundle of nerves called the brachial plexus. And that sends information from the neck down through the shoulders, the arms, all the way down to the fingers. So some of the symptoms a person could have would be neck pains, shoulder pains, numbness and tingling down the arms, all the way down to the fingers. Now this area here is called the lumbar plexus. And some of the and that sends information from the waist down through the buttocks, thighs, knees, calves, all the way down to the toes. So some of the symptoms there would be with cystialia or waist pains, buttocks pains, thigh pains, knee pains, numbness and tingling down the legs, down to the toes. It could cause impotence in some men, menstrual problems in some females, as well as bladder problems and things like that. Now, when you look at your spine from the side, there should be 4 curves. A curve in the neck, the mid-back, the low back, as well as the buttocks. Now, the curve in the neck and in the lower back should be in this direction. And the curve in the mid-back and in the buttock should be curved in the opposite direction. Now, if there is too much of a curve, as you see here, or too small of a curve, in any of those 4 areas, when you're looking at it from the side, that is not good. Now, most people come to us because of pain, but that's not the only reason you should go to a chiropractor. And the reason why is because whenever these bones go out of alignment, it could put pressure on the nerves that sends information to specific areas of the body, like the nerves of the heart, the lung, the liver, the gallbladder, and so forth, so on. Now, a lot of people wonder, why is it, why is it that I have these problems? And the simple answer is stress. And there's 3 types of stresses. There's physical, there's chemical, as well as emotional stress. But when we have these specific stresses, it can cause our body to tense up or whatever, and then put pressure on the nerves. And let's say the bone here puts pressure on the nerve here. That's T2. That nerve sends information directly to the heart. And the heart is both intrinsic as well as extrinsic, meaning that it works with nerves or without nerves. So if I was to take your heart out of the body, out of your body, it will pump for a little while. Boom, 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 boom. But eventually what happens? It will stop. And the reason why is because there's not enough nerve flow and not enough blood flow going to those specific areas of the body. Okay? So chiropractic helps your body to be a better you by taking the pressure off of the nerves so it can respond better to prevent something called a subluxation. Now, have you ever heard the word subluxation before?
Yeah, I've heard you talk about it on radio.
You've heard me talk about it on radio before. Now, a subluxation, do you know what it is?
You tell us.
Okay, all right. I was quizzing you up to see if you do. A subluxation is what we call a misalignment, a bone out of place. In fact, if you was to break that word down, sub means less than or below. Lux means light or life. And ation is the state of being. So when you have a subluxation, you have less light, less life, less energy going to certain areas of your body. So your nerves are being choked. Okay? So it's not able to function at its proper level. Okay? I hope that gives you an idea of what what I do as a chiropractor.
You know, basically you talked about using your hands.
Yes.
So how does a hand become a creative tool?
Well, I guess you can use your hands for destruction, or you can use your hands to save lives. And through chiropractic, we use our hands to save lives. We're trained in chiropractic in fact, we're doctors. We're doctors of chiropractic, and we're trained to actually use our fingers to be able to feel specific vertebrae out of alignment or subluxations. Now, as we're touching that spine, we're feeling for slight movements. Like it could be that the vertebrae has shifted a little bit. And see what's around these bones? Muscles and ligaments. Muscles and ligaments. So when these vertebrae go out of alignment, the muscles are a little bit more tensed in certain areas. So we're actually trained, like for instance, if you was to get a Bible or something like that, a Quran, whatever, if you was to get one of those and put a piece of hair in that Bible, I could actually find it. If you put it in, let's say, 50 or 100 pages, I could find that piece of hair where exactly it's at. And the reason being is because we were trained to be able to feel where specific areas are, something that's misaligned in the body. But we basically use our hands to adjust that spine. Now, some people say the word manipulation. Manipulation is more, you don't know exactly which vertebrae you're moving. But when you're adjusting the spine, you're finding a specific area of the vertebrae of your neck or your back or wherever, and we're moving that specific area back into its place. Like for instance, if you have sinus problems, C2 sends information directly to the sinuses. C1 sends information to the head, so it can be.
What's C1 and C2?
And eyes. Okay. I'm sorry.
What's C1 and C2?
There's 7 cervicals, 12 thoracics, and 5 lumbars.
Okay.
C1 is the first cervical. C2 is the second cervical. C3 is the third cervical. All the way down to C7, which is the last cervical. And then the same thing, T1 all the way to T12. That's thoracic, or some people may say D for dorsal. And then lumbar, 5, 4, 3, 2, 1, or 1, 2, 3, 4, 5 are the lumbar. And see, L3, that deals specifically with, I'm talking to a man, so I may as well talk about this because a lot of people, they have these issues as well. Yeah. It can cause impotence. Okay, can affect the reproductive area. A lot of women complain of menstrual cramps, painful menstrual cramps. So adjusting that L3 area or adjusting that sacrum area can help that area get better. But when we adjust that spine, we use our, there's over 1,000 different techniques out there as far as chiropractic is concerned. But when we find that specific vertebrae out of alignment, then we adjust it so the body can operate at its optimal level. We've heard a lot about the spine being a very important organ in the human body. But however, a lot of people do not know the specific roles or importance of the spine to our human body. Can you take us through really what really the spine does? Take your time and explain that, critically what it really does for the human body. Well, the spine actually protects and houses the most important organ of the body, and that's the nervous system, the central nervous system. See, the central nervous system consists of the brain and the spinal cord, and then the nerves flow after that. So the brain is housed, or I should say the skull houses the brain. The brain sends information down the medulla oblongata, or the brainstem, down through the spinal cord, through all the nerves of the body. Now, if the spine was not there, your body would be just like a bowl of jelly. Because if I took your whole spine out of your body, you would not be able to function at all. You would not be able to function. The first major organ to form in the body was the brain. Then the spinal cord, then the spinal nerves, then all else formed after that. Now, most people thought it probably would be the heart. In fact, if it wasn't, you're not legally dead. Your heart could stop working, but you're not truly legally dead unless your brain stops working because information is not coming from that brain through that medulla oblongata, brainstem, through that nerve to
The heart.
the heart area. So that's how important your nervous system is. It's the first organ to form, but if you have a heart attack or whatever, it's the last thing to go. It's like your soul, okay? As a part of your soul, because you're not thinking right now. You are thinking, but you're not even thinking that you're thinking. If it wasn't for your nervous system, you would not be able to look me in the eye. If it wasn't for that nervous system, you would not be able to touch the piece of paper and feel it. If it wasn't for your nervous system, you wouldn't have been able to put on your clothes. You would not be able to sit. You would not be able to blink, which you're not even thinking about. All these things, if I was to touch you, it didn't take time for you to think of me touching you. It just went straight down and went back up.
So it's the nervous system that works on that.
It's the nervous system that's doing all those things. The peripheral is the nervous system.
But then it's connected to the spine.
No, that houses
The
the spine houses
The nervous
that
system.
nervous system.
Okay.
So it protects that nervous system. So that's why the spine is so important, or the vertebrae is so important, because it actually houses the most important organ. It protects it, and it's the only bones that protects an organ like so. And that's that nervous. I mean, that's the spine.
So when do you have to pay attention to your spine? How often should one go to check a spine to ensure that the vertebrae are aligned? And because just as you do the normal health check to make sure that everything, your bladder, your urine, your whatever is working, your hypertension and all that, is okay and all that. How often do you have to check your spine?
Well, that's a difficult question. And the reason why I say it's a difficult question is because most people, they don't get their spines checked. See, we have a saying in chiropractic, from the womb to the tomb. Now, fortunately, from the womb to
That's
the tomb.
scary.
Yes. Fortunately, I'm a chiropractor. So my children get checked on a regular basis. Okay. Unfortunately, we're always going to have some type of stresses in our life, either physical, chemical, or emotional. In fact, do you know when the first subluxation possibly occurred in your body?
When I was born?
Exactly, when you was born. And the reason why is because, you're smarter than you look, man. I'm just joking.
Yeah, that's okay. That's okay.
And the reason why is because the doctor or the midwife, he or she may pull the baby's head out of the mother's womb. Then they'll turn the baby's head 180 degrees to one side and plop the shoulder out. Then they'll turn the baby's head another 180 degrees to the other side and plop the other shoulder out. If he or she can't do that, they may use forceps and yank the baby's head out, or use a vacuum and suck the baby's head out, or of course a C-section. All these things could cause trauma to that newborn baby. But then as the child gets older, he or she learns how to crawl, and what happened? They fall. Then they learn how to sit. They fall. Then they learn how to stand. They fall. They learn how to walk. They fall. They fall out of bed. They learn how to run. They may have brothers and sisters who push them down, have friends playing soccer. But then as they get older, they learn how to sit, or they sit improperly. What I call the mapacho look. Okay, they sit improperly. They may sleep on the couch with the pillow too high, which causes neck strains. On the computer, typing, reading. All these things can cause your body not to respond properly. That's why you should always have your spine checked. And some people may get checked every 6 months. Some people may get checked every year. I personally get adjusted once a week. That's me personally, because I know that I have stresses in my life. It may be stresses from exercising. It may be stresses from being on the computer, or being on the phone, or writing, or just having mental strains, because our body, we have the stresses of the world. You got all this traffic. You have these lights going on and off. You got money stresses. You have family stresses. You have children's stresses. You have wife stresses. You have so many different stresses.
Why wife stress, not a husband stress?
Because I'm a man. I'm not a lady. Yeah, the ladies would say husband stresses.
That's right.
You know, why would I say wife stresses being man stresses when I have it's not that type of party, no.
That's right. You're right.
So that's why I said what I said. But for the women, I know my wife probably have stress of me because I can be difficult sometimes. Children stresses. The children are stressed because of their parents. You know, all these different things. You have to pay for bills. You have to pay for schooling. All these are mental stresses that can cause a physical problem on the person's body. But people take that for granted. And see, we're dying at an early age here. We're dying at 60 years of age. I think it may be 61. And we're ranked, at one time we was ranked 135.
The life expectancy rate of Ghanaians today has moved down.
It's very bad. Togo is better now. You know that? Togo is better than Ghana right now in life expectancy. Yes. We need to make changes. The pollution in this world is causing specific problems and manifest in our bodies. All these things that we need to do to become healthier, we need to start consciously making an effort to make these changes. And people are starting to make more changes, but they can do better.
You know, I want us to focus on corporate people because they go through the kind of stresses that we talk about, especially during the day and this time of the economic situation that we find ourselves in. A lot more people go through a lot of stress, and most importantly, even pregnant women. I mean, today most women are getting married and they're getting pregnant, you know, and they have to go through the stress of carrying the baby and going to work and taking care of the children and doing all that. Such people, how should they handle, or what effect it has on their spine, and how can they handle this stress with this spine problem?
Well, and that's good. I have 3 children, and my wife, as she was carrying the baby, she was getting chiropractic care. And the reason being is because a lot of times when you have that extra weight, it's putting pressure, causing problems with the spine because the belly is out and it's causing your back to go out of alignment. And then a lot of times
the sleeping position,
and all these things can cause your ribs to go out of alignment. And when you adjust, when I adjustment is the treatment that we do as a chiropractor. When I adjust that area, it actually helps to move that vertebrae back into alignment, so it takes some of the pressure off of those nerves and causes less pains on that person's body. So that's, those are some of the things that we would do for a lady that may be pregnant, okay, or have already had their child, because they still may have some extra weight on their body that could be causing problems. They may even be small individuals whose vertebrae may have gone out of alignment. But you're 100% right. A lot of the pregnant ladies are having a lot of emotional and traumatic pressure on their body that needs to be taken care of, and they should look up a chiropractor. If I'm not in the area, find a chiropractor near them. But of course.
But you are the best, so.
But I feel I'm the best.
They should come to you right away and not look for anywhere else.
Yes,
that's basically. But the other thing I also want to find out that we seem to be recording a lot of what you call stroke. These days. I mean, unfortunately, we seem to be having a number that's increasing. How can you help people like that? Can these people be helped through chiropractic?
Yes, we can help people that have strokes. Unfortunately, because they have gotten to that level, because they have a stroke already, we can't reverse that stroke. We may help get them out of some of their symptoms that they're going through, help them to get more mobility, help them to get out of less pain, and be able to move better, even through the adjustments, we may even help their speech a little
Okay.
bit. But we do not cure strokes. In fact, we don't cure any specific problem. And sometimes people wonder, what do you mean you don't cure anything? See, I take myself out of it as much as I possibly can. I don't give credit. I don't take it away. I just let your body do what it's supposed to do and allow the innate power within you to do what it's supposed to do so it can become healthier. See, I'm not the healer.
Well,
your body is the healer.
okay.
I hope you understand what I'm saying. I don't want to put it as if I'm the healer, because once I start thinking it's me, I'm out of my scope at that particular point. It's you, and I want you to be a better you. So your body needs
How
no
do I
help.
become?
How can you be a better you?
Yeah, that's right.
Your body needs no help, just no interference. I hope you understand what I say. What I said just then. Your body needs no help at all, just no interference. And when this bone goes out of alignment, it interferes with your life force. So when I adjust that area, it takes away the pressure from that nerve so you can work at your optimal level. I hope you understand. So you can be the best that you can possibly be. Now, sometimes it may take time, because it took time for your body to get to that situation. But we don't necessarily cure problems, even though as they start getting adjusted, they start to notice that their symptoms and their other problems start to go away. But we don't necessarily cure specific problems. I know people, they like to hear the word cure all the time. But, I'm not going to say that I cure anything, because I know that it's your body that's doing the work. It's just like these drugs a lot of times. These drugs are not curing anyone. Okay? It basically hides the symptoms. It hides the symptoms, but it doesn't get to the cause of the problem. And that's what our job is to get to the cause of that problem. Now, I see you starting to sit up a little bit better. You're saying, hey, look, Dr. Cox looked like he's sitting up straight, so let me sit up a little straighter too. I saw that,
Right, come on.
And you was talking about business, right?
Yeah.
So now we're going to talk a little bit about how the business people are, how they sit, how they should sit. They should sit upright. Now, of course, because they're on a computer, they should have their computer sitting a certain type of way. But unfortunately, we can't, as a business person, you can't sit like this all the time. You can't sit proper all the time. So that's why you need to get an adjustment from time to time. Even individuals who are working out, they need to get adjusted from time to time so they can operate at their optimal level.
I really want us to go, because you talked about people who might want to seek for chiropractic, remedies. In some, maybe they are not in Accra, they are somewhere in the north and all that. So, what really are the clear qualities of a chiropractic physician?
Do they have a chiropractor up in the north?
Should they want to visit a chiropractic? What are the clear qualities they should be identifying? Because really, if it's not a curative process, at least, even the person's appearance and the way the person communicate with you can even heal you one way or the other.
Right.
So, but you need to be you need to identify certain good traits in the person to know that this indeed is the best of chiropractic physician that I can work with.
Right. Now, the first thing, they must be they must have graduated from accredited school, an accredited university, or I'll say chiropractic college. That's the number one thing. If they didn't go to an accredited chiropractic college that we know of, then don't even deal with it. So if you need to, ask them for their degree. Because every chiropractor, true chiropractor, because some of these people they say they do chiropractic care, but they're not chiropractors. So some people are lying to you. They may be massage therapists, and I'm not against massage therapists or against any other profession.
Oh, there is a difference between a massage therapist
Of course,
and a
there's a
chiropractic.
it's a difference. Now we have massage therapists.
What's
in
the
our
difference? What's the difference?
Massage therapists deal with the muscles, so
Okay.
they're massaging the
Okay.
muscles.
Okay.
Where a chiropractor adjusts the spine. So we find specific vertebrae in the spine, and we adjust it. We move it back into its proper place, and it's just a slight movement, but we move it in the spot possible in their proper place. Yes. So that's the difference, the main difference. Also, we're doctors. No matter what anybody want to say, we're doctors.
No,
we went through years of training.
Specialization in spinal.
Exactly.
Yeah, so definitely makes you a doctor.
Yes, I mean, we had like me. I went through 7 years of college. Well, I went a little longer than that. 4 years of undergraduate degree. And then after that, I set out and worked for a little while, and then I went to do my prerequisites for chiropractic college. So, I did over 8 years of schooling to become a chiropractor. I was selling a computer to someone, and the guy said, "So where did you go to school?" And I said, I went to James Madison and got my undergraduate degree in kinesiology, which was the study of the movements of the body. He said, "So why aren't you doing something dealing with the body?" I said, "I don't know. I like this job here." And then he said, "Well, why don't you look into chiropractic?"
Oh, that time you were selling computers.
I was selling computers, even though I had majored in this specific thing. He said, "I've been to chiropractors because I played football, ran track, and did so many, American football. I did all these different things, but with injuries, I went to chiropractors, and I still didn't know much about what chiropractic was because I wasn't educated on it. But I went to one. And one thing led to another. He said, "Well, why don't you look into chiropractic?" I said, "Chiro what?" Because I still didn't understand it, even though I went to chiropractors, and they would somehow really treat me because of pain. But I didn't have a full understanding, a full knowledge of what chiropractic was. So then I did my research on what chiropractic was, and I realized that there are 3 types of chiropractors. There are chiropractors who focus on the philosophy of chiropractic, deals with more of the philosophy. Some deal more with science, and then some are mixed, which is a combination of both. I'm more of a mixed person. I do a combination of both. And I did my research on which chiropractic college to go to, and I decided to go to Life University, which I felt was the best chiropractic college in the world. So one thing led to another, and my job allowed me to go there and work as well. I went to Life University in Marietta, Georgia, and it was the best thing that happened to me.
Yeah, that's where you are today.
Yes, that's
what made you what you are today.
Yeah, and I've been able to do things that I don't think that I would have been able to do if I hadn't done the chiropractic as well as come to Ghana.
Seriously, I was going to ask you that. Have you ever had a challenge, not a challenge, but really faced a patient who had come to you that you were not able to help? And what was the situation, and how did you handle that?
How did I handle it? Okay, the first time it happened, I didn't handle it too well. The first few times, I didn't handle it too well because I want to help every single patient, and I feel that every person, I don't even like to use the word patient because I like to use the word member, because when you think of patients, you think of sick people. And I don't want to feel that anybody who comes to my office is a sick person. They may not be feeling well. They may have dis-ease. Dis-ease. Not disease, but dis-ease, which can cause disease. But I don't want them to be necessarily considered to be sick people. So that's why I call my members or my patients members. But I didn't feel too good when I first had my patient didn't feel like they would like to. And I still have patients who don't get the optimal care that I would like them to have, because they may have had too much degenerative problems going on in their body, or they may have had a stroke that has gotten to a certain level. Now, I feel that every single person that comes to our office gets some type of results, but they may not get the type of results that they were looking for. And that sometimes that hurts me because of that ego that I may have. But at the same time, I don't cure anything. I don't cure anyone. I let their body do what it's supposed to. So I will let their bodies be the best them they can possibly
but
be.
You should be aiding the body as well.
I'm aiding it, yes. I'm definitely aiding the body through adjusting them, even through my air, me even being personable to that person, smiling.
So you need a relationship.
Yes,
with the
it's
person,
good to have a relationship
with a member.
With a member. It's also our staff. Our staff does a wonderful job as well at the spinal clinic. We do a wonderful job. In fact, we are nominated. I'm kind of bragging on us right this second, but
you have a bragging right today now.
I can brag, huh?
Yeah, just go ahead.
Let me brag. Okay. Our staff, they do such a wonderful job that we were nominated twice. Well, not nominated. We've given the Customer Service Award twice, and we're named in the Hall of Fame in Ghana Customer Service Award. Yeah. So I can't even remember what year that was. We got the second one. It was either last year or 2 years ago.
So Bryan, Dr. Bryan, let me ask you this: what should someone expect the first time he enters the office?
Well, the first thing they need to do is they need to come there. Well, they should come in with a smile. If they don't have a smile when they first walk in the door, let me know. We're going to get that straight. Okay, the operations manager's over there, and
the person is coming with a pain, some depressed moments or sentiments, and so therefore you should not be expecting an outright smile. But
I'm not talking about them. I'm talking about my staff.
Okay.
My staff needs to have a smile on their face. They don't need to be looking like this because they're already having pains. They're already having emotional stresses. They're having problems. So the first thing that the patient should see is a smile on that person's face. And if they don't see a smile on that person's face, they need to talk to Dr. Cox, because I'm not going to be happy. Because they need to be, the staff needs to take care of that patient as if it's their own child.
Great.
Or their own mother, or their own father, or whomever. So that's the first thing you should expect. The second thing is they'll ask them some questions. They'll do a consultation on them. After they do the consultation, they'll set up a time for them to do an examination. Through that examination, the doctor will look at x-rays, do the examination, palpate the spine, do range of motion tests, do different types of things. We'll do a series of different tests. After that, we'll do the adjustment. An adjustment is what we call that room the life enhancement room, because when you're getting adjusted, you're bringing life back to that person's body.
The theater type of room that you have to enter? Or
well, it's not no scary room. It's it's not a theater type of room, but it's the life enhancement room. It has like a couple of tables in there and a few instruments, because some people may not be able to handle my hands because they may have so much degenerative issues, or they may have osteoporosis or whatever. So I may use instruments instead to get them healthier. But the first thing is for them to fill out information and set up a time for or do a consultation on them. But that would be the first. Well, the first thing is to smile, and then after that
you move on. So who are your target market?
Well, I used to say everyone, but
it can't be everyone.
But it can't be everyone. It can't be every single person. I would like to say it's because a lot of people have been getting better because of pain. That has I guess, kind of been my target market, but I don't like it that everybody that comes to my office are there because of pain. Yeah, people are getting better because of pain, but I would love for people to come there because they just want to they want to be able to live a more optimal life. That's who I would prefer to have come to the office. However, most people that come to our office come because of pain and things like that. Businesses, I have a lot of businessmen and women who come to our office who get adjusted. But because of time, they sometimes may not be able to come as regular as I would like it. But I would say businessmen and women would be the people that...
You know, talking to you for the first time makes me feel that you have so much passion for what you love what you do. You put a lot of effort in what you do. But do you think that the people leave there also with a comfort and the healing that they so much will hear you talk on radio and TV and get so relieved that this could be the person that can help me? Do they carry away that sentiment after talking to you, after leaving the place?
I believe so. You know, because I don't know how people respond outside, but from what I'm gathering, I hear a lot of positive things about the spinal clinic. You know, I can't speak on other places and things like that, but as far as the spinal clinic is concerned, I hear good things about the spinal clinic. I don't hear a lot of negative things. You know, if anything, I would hear, you know, I may hear that, you know, our prices are too high, or something like that. But I wouldn't say that our prices are too high.
No, you wouldn't say it, but there's a final customer who perhaps feels the punch, so he would say it, that the prices are too high.
You know,
I mean, is there a way you can do something about it?
Well, I've done stuff about it. At the same time, you have to charge.
Because the numbers matter.
Yes.
The numbers matter. I mean, so if a price is a disincentive, you know, you can have the numbers.
Exactly. Well, the thing is this. I understand that. That's why my prices are reasonably priced. And I would say if you was to look at our prices compared to others, we're definitely
I'm
low.
not looking at comparative, you know, variables here, but I'm looking at you and making sure that your service, because you see, you seem to have the passion for what you do. I mean, you come across as somebody who really will want to help, but then you have a blockade. The blockade is the price.
And you're saying that, and it sounds great. However, think about this. You have staff to pay. You have a place, like if you're renting a place, you're paying for rent. That rent costs in dollars. Even though we're supposed to do in CDs, it costs dollars.
Well, unfortunately, our time is up. You've been listening to Dr. Bryan Cox. He is the CEO of the Spinal Clinic, and indeed, look, he said a lot that if you missed it, the early part of the discussion, you can watch a repeat version in the evening, because this is our corporate health segment, and I just don't want anybody to miss any minute of our corporate health segment, because it deals with our health. And for us to be very productive, you need to be healthy. Dr. Ndum talks about something that really, you know, really matters to me, that they look at you for the first time and you see that you're not healthy. That means you can't be productive, you know, and that's the most important thing in the corporate environment today, that everybody needs to do a check of himself, do a health check every year, at least, if not at all, once every year. And I think the spinal clinic is where you need to visit too, so you can check your spine, because like you said, the sense of touch, the sense of taste, all the senses, it's generated from the spine, and it's important to pay very good attention to your spine as well.